Hi, Rose. How are you?
I'm good, thank you.
Did you have any problem finding the place?
No, everything kind of worked out. I got here hopefully on time.
Oh, yeah, sure. All right, well, good.
Yeah.
So tell me what brings you in today.
Well, I am having a difficult time because my husband thinks that I should be coming in. Our child has been abusing every drug I can think of for the past, that I know of, about 3 years. And my husband thinks I need to come in just to talk about the situation.
Mm-hmm. How old is your son?
He's 21.
21?
Mm-hmm.
And so you say he's been using substances for like the past 3 years that you're aware of?
Mm-hmm. Mm-hmm. Yeah, and I don't really know. I know right now he's actively smoking marijuana, and that is not good. Like, it does not help him in his behavior or motivation, or, he's 21. I feel like he should be where all the other 21-year-olds are, which is graduating from college or coming to it, and so it's just not what I was expecting of him.
Sounds like you're a little bit just disappointed, maybe?
Yeah, definitely disappointed, yeah.
Okay.
I would say that's disappointed, hurt, a little lost.
Yeah, understandably so.
Yeah.
Does he live at home with you and your husband?
He does, yes. Yeah.
Okay.
He does, yeah.
Does he work?
He's had a couple jobs, but not right now. He does not work. He worked recently at a state park, and kept that for like a month, maybe a month, being generous.
Mm-hmm.
And then just didn't, stop showing up. I don't know, I don't know if it was this job or the job before that he was caught with something on the grounds, and, just wasn't able to keep the job.
Right.
Right, yeah.
Okay. How is you and your husband's relationship with this situation?
Well, you mean between us two, or between him and us? Or?
Well, you said that your husband thought that you needed to come in and talk to someone about this, so do you and your husband agree on things right now?
Well, he thinks I'm too involved and that I care too much, which doesn't make sense because I'm his mother, so I think I should be caring too much. And, I work, and so does my husband, so we see him, we've always seen him when we get home, so I get worried about him during the day, so I try to take my lunch and go home. I just try to make sure I'm keeping an eye on him and there if he needs me, and my husband thinks that that's too much, or that I'm taking it into my hands, is what he says, and I don't see his point. Sounds like a normal thing that a mom would do.
Right.
So I don't really understand what his point is. Like I said, I really don't.
Mm-hmm.
But I do love him, and I know that we've always worked together, and that he takes my advice, I take his advice. So I think I decided I'll go just to go.
Mm-hmm.
So I think my son should be in treatment, not me.
Right. Well, it's important too, that you're talking to someone so that you can express your concerns and make sure that anxiety or issues that you have revolving around this situation,
Right, yeah.
aren't left what's the word I'm looking for? Unresolved.
Right, yeah.
Okay.
Well, I kind of wish that I would just use these sessions mainly just to figure out what I can do for my son. I feel like I want to know more what I could do for him, and I could use the time here, but I also think I want to be productive and help my son during my time here, not so much like just me.
Mm-hmm. Have you sat down and talked to your son about the situation?
Yes, I have, and we put him in treatment. He's been in and out of inpatients a couple times, and we sat down. Sometimes I think he might have just lost some of his understanding ability, especially if he's in the middle of if he's using,
Mm-hmm.
he kind of doesn't take me seriously. I talked to him, yes, I have talked to him, and he's expressed that he wants to stop, and he knows that it's not helping, but then he always goes and uses anyway, so, I just don't understand it, you know. And like we'll lend him money to go, you know, fill up his tank with gas, and he'll come home with a gallon and in his car, and then you know, out of it. So it really is the saddest thing I've ever seen.
Right. So you think he's taking your money and using it to get his drugs?
Yeah, for sure. Yeah.
Have you and your husband set up any house rules for him?
We've tried. I mean, I feel like we maybe didn't do that most of his life, so it's like hard to do it now when he's 21. We said like no drugs in the house, but he still does it. Nothing too serious. Mainly just marijuana he smokes in the house, and you know, he and my husband get in fights like all the time about it. And so I'm trying to figure out like other things that I can do in the house, like put up cameras, or so that I can say, look, I saw you doing this, or I mean, but I don't know. I haven't really established any rules now.
And what do you think he would say if you did catch him doing it and you confronted him?
Sometimes I think he would just be like, obviously, you know. Maybe he would be embarrassed, I guess, you know, just be embarrassed to get caught. Or he maybe would deny it, say he was doing something different, or if I really caught him very well, I think he would be like, again, oh yeah, Mom, I'm going to work on it.
Addiction's so tough. Yeah. So, tell me a little bit more about what he does. I know you said that during the day you and your husband work. Does he just hang out at the house during the day while you all are gone, or does he have friends that he hangs with?
He has some friends. We've tried to get him involved, like I said, in some treatments. So sometimes he used to do that, like go to the treatments during the day, which was very relieving. I didn't have to worry about him while he was there. But, you know, not much. He'll watch TV. He's got a dog, so he'll take care of the dog. And then he says that he's like applying for jobs, so he'll be on his computer doing that kind of stuff. So that's currently what he's doing.
Does he have chores? Do you have chores for him to do to kind of, you know, maintain, you know, since he's not contributing, you know?
Yeah, not really. My husband and I make enough that I can have someone come and clean, because I can't clean, and my son was always, you know, too young to clean, and then before I knew it, I just hadn't really, you know, I didn't want to make him clean, just because I'm not home, I don't want to make him clean. So not really, no. I mean, he makes his bed every once in a while, and we'll put his laundry in the laundry bin. So that's about as much as he does.
Okay.
Sorry, I'm going to check this out for you. We're good.
So what is it that you would like to get out of these sessions?
I would like for my son not to be using drugs anymore. But I don't know if that's what I'm going to get out of these sessions. I know because my husband asked me to come here, I think I would want us to be able to see eye to eye, I guess. Maybe that's something maybe that I would like to get out of it.
Would you be willing to have your husband come with you, or do you think he would want to come with you and kind of do a joint session?
I think so, yeah. Yeah, I think so.
I think that might be helpful. A lot of times, you know, when children are abusing substances in the home, it can cause a lot of discontent between the parents. And so if you both are on the same page, you know, it seems to work a whole lot better in trying to set rules and boundaries. You know, and we'll look at maybe things that you all are doing that could possibly be enabling him in his choice to use the drugs. I know as a parent, you want the best for your child. And it's hard to see them not living up to what your expectations were of them, but ultimately it's their choice. So, if your husband comes in with you, we can kind of discuss things within the home that maybe the two of you can work on together to try to help him.
That would be great. That would be really great.
Okay.
Yeah, thank you.
All right. Well, thank you for coming in.
Yeah, no, of course. Thank you for your time. I appreciate it.
Thank you.
All right.